At the same time, we can say in the cervical spine, we have the maximum mobility but the least amount of stability. Okay, now we discuss a bit more about the intervertebral disc. We will be talking about the structure of it. Most of us, we might be knowing that this section, this thing over here, this is the intervertebral disc between the vertebrae. So this is the vertebra, the top one, and this is the top, this is the lower vertebra. So this section, this thing over here is the intervertebral disc. Now we discuss a bit more about it. So we can talking about the structure of the intervertebral disc. It has got a central section, this thing called as the nucleus pulposus. So this thing is called as the nucleus pulposus. Then followed by this section, or this section over here, that is called as the annulus fibrosus. And then we have two strong kind of plates on each section, each part of the intervertebral disc. That's this one and this one, called as the cartilaginous end plate or the vertebral end plate. All right, so here we can see, if we discuss a bit more about the percentage of structures present in these in the intervertebral disc. So mostly we get to see we have three most prominent structures. We have some amount of water available in it, we have the proteoglycans, and we have the collagen. So the proteoglycans, it helps in the process of imbibition or diffusion, as in like the presence of proteoglycans helps in letting the fluids go more into the intervertebral disc, which eventually helps the disc to get more nutrition. We would be discussing a bit more about how the disc gets its nutrition in the following slides. Talking about the collagen, the function of the collagen is to provide stability, to provide strength, and then we have water as well. So if we talk about the end plate, the function of the end plate is to provide a strong structure to the intervertebral disc. Hence, we can see that it has got the least amount of proteoglycans and water and the maximum amount of collagen, that is 25%. We won't be able to see this level of collagen in any of the other structures. We can see we have 4% collagen in the nucleus pulposus, which is the innermost section, innermost part of the intervertebral disc, which is not that strong, very jelly kind of structure. And then we just have 15% of collagen in the annulus fibrosus, which kind of determines, as we go more towards the inner part of the intervertebral disc, it starts getting a bit weaker. So the innermost structure, the nucleus pulposus, just 4% collagen, and the outermost structure has got maximum 25% collagen. And on the contrary, the amount of water availability, it's the least in the end plate. The outer structures, the end plate, it's the least, that's 55%. And talking about the innermost structure, the nucleus pulposus, it has got 77% of water available. Okay, I don't think anyone is going to ask you the percentage, the exact numbers, but you should be knowing how much, like first of all, what are the structures available there in the intervertebral disc, the collagen, the proteoglycans, and the water, and almost like just get an idea like which is more in which structure. That should be more than enough, I believe. Okay, and that's what this slide talks about. We have the water, we have the collagen, and we have the proteoglycans present there. Talking about the proteoglycans, as we discussed, it's higher in the nucleus and it's the lowest is in the annulus fibrosus, and it's the other way around for other structures. Okay, now if we move further, we need to talk about the innervations, the nerve innervations in the intervertebral disc, and we would be talking about how the intervertebral disc gets its nutrition. So first of all, talking about the disc innervation, like how and how much amount of nerves are there available in the intervertebral disc. So what we get to see, it's only the outer half to 1/3. So the outer half to 1/3 of the fibers of the annulus fibrosus. So mostly this section here, we talk about, if we talk about this picture, the outer section, this one, and that too just one third to half of the annulus fibrosus has got the nerve innervations, and it is innervated by the vertebral and the sinovertebral nerves. And that too just in the cervical and the lumbar region. What we get to see in the thoracic spine, there is not much of innervation. Most of the nerve innervation is either in the cervical part or in the lumbar region, and that too just in the annulus fibrosus, and that also just one third to half of that. The nucleus pulposus has not got any innervation at all. So if there is any kind of tear in the nucleus pulposus, we are not going to experience much of pain. We get to see, like in most of our practices, if there is any person having low back pain, and if the scans talk about the disc protrusion, we just straight away jump to the conclusion that it might be the disc causing the pain. But to be honest, that's not always the situation. Like I have seen people having disc protrusion at a very high grade and still having very minimal discomfort to no discomfort at all, and at the same time there might be people having not much of tear or not much of protrusion in the intervertebral disc, still they experience a lot of low back pain. So it's not always necessarily the protrusion of the intervertebral disc causing the low back. There could be other reasons as well. So we really need to assess a person to be able to figure out what exactly is causing the low back pain. Okay, and now talking about the like how an intervertebral disc gets its nutrition. So there is no major blood supply or no major arterial branches which provides blood to the intervertebral disc. There might be a couple of small branches, or we call them the metaphyseal arterial supply, which might be providing the outer section of again the annulus fibrosus. But again, as a person ages, and as the age increases, these innervations by the arteries starts getting destroyed. So mostly an intervertebral disc is not much dependent on the blood circulation to get its nutrition. So how does it get its nutrition? So the main thing that helps an intervertebral disc to get its nutrition is through the process of diffusion. Now the thing is, it's a soft cushion structure, right? And that's present between two vertebrae. So it's the constant contraction and relaxation of this cushion which helps the fluid around it to enter and exit the structure. Just imagine it to be something like soft spongy thing, and if we keep that in water, when we contract the sponge, the water comes out of it, and when we release it, it again absorbs the water. That's something similar what's happening with the intervertebral disc as well. There is one more structure in the body that also follows similar kind of pattern to get its nutrition, and that's the meniscus. So in the knee, if we talk about this soft tissue between the femur and the tibia, this soft cushion structure called as the meniscus, again it's the constant contraction and relaxation of that meniscus, the sponge like structure, which helps in the absorption of the synovial fluid, hence letting the nutrition to go into the structures of the meniscus and then coming out. That's the same thing happening with the intervertebral disc as well, and that explains how important it is for a person to bear weight on their legs, to stand, to walk. And that kind of explains why after an injury, as a physio, we don't let a person to be bedridden for a very long time. Maybe after a surgery, or maybe after any condition, we need to move the person as soon as possible, because as the person gets on their legs, on their feet, they start having contraction and relaxation of these menisci in the knee and the intervertebral disc, hence leading to more nutrition in these structures, and that helps and that aids in the healing process. That's why it's very very important. So it's mostly through diffusion how all these nutrients enter and exit the intervertebral disc. Okay, moving further to the structure of the vertebrae again. So in the previous videos we discussed that this is This is the vertebral body, and these are the posterior structures. We call them as neural arch as well, because most of the nerves, it enters and exits through the posterior, the backward section of the vertebra.